Coronavirus. What should we do? I'm taping this right now on March 10th of 2020. News is coming at us really fast. Let's see if we can navigate through a little bit of this. And before I begin, actually, I'm going to talk about strategies that you can do for yourself and your family right now to improve your overall health. That's what I'm going to get into in a moment. First thing I have to do is say this is not medical advice. If you have any questions, if you have an illness, you need to talk with your doctor, do your appropriate emergency things, whatever you need to do, you go get the appropriate medical care and follow the advice of your public health officials, your hospital, your emergency room, your doctor, whoever you're working with, okay? This is not medical advice. But let's navigate through some of the things that are coming at us, okay? So COVID-19, this new strain of the coronavirus, and so far it looks like it's behaving like a flu, okay? I'm not a microbiologist, I'm not a public health expert, but I'm just listening to the things, and I like to listen to the news information that we're getting right now that focuses more on the virulence of this particular virus so far. The head of the CDC folks that are watching this and the public health officials that are watching this are saying there's a lot of unknowns at this point, so we can't say how this is going to particularly flow, right? But so far, if you look at some numbers, let's look at some numbers here so we can just put a little perspective on this. And I think this would be the first thing that we all need to do is put a little perspective on this. So far, just the coronavirus, COVID-19, right now, worldwide, 100,000 people have identified as becoming down with the illness, and there's 3,000 deaths worldwide, which is unfortunate. Comparing that to our own CDC's statistics, just for the United States, just for this flu season in 2019 to 2020, we've had 34 million people get sick with influenza, 350,000 people have been hospitalized, and 20,000 deaths so far just in the United States, just in this flu season, which is far from over. Putting a little perspective in there. Let's look at the past couple of years. Again, right off of our CDC, the 2018-2019 season, just in the United States, we're not talking worldwide, just the United States, 35 million people were sick, 16 million people needed care, 500,000 hospitalizations from influenza now, and 34,000 deaths just in the United States just last year. Look at this now, the 2017-2018 flu season, again, these are just United States numbers, not worldwide, 61,000 deaths just 2 years ago, 61,000 deaths. Did you ever see that on the headlines? You didn't. A little perspective, I think, might help us here. There were 45 million people that got sick from the influenza, from the flu 2 years ago in this country. And let's really put it into perspective. I've done a few shows on this in the past. This is a great time to remember the 1918 flu pandemic. So 102 years ago now. Here's the statistics. 500 million people around the world were sickened. That is 1/3 of the world's population at that time. So there were approximately 1.5 billion people on the planet 102 years ago. 1/3 of them got sick with this flu. There were at least 50 million people that died on the planet at that time. So what's that, 10% or so, 5%, something like that. And it was just huge numbers, huge numbers. There were 675,000 deaths just in the United States 102 years ago with the 1918 flu pandemic. Now, just astronomical figures. Could you imagine just 1 million people dying worldwide in a flu year? Could you imagine 500,000 people in the United States, 675,000 people dying in a flu season just now, in a regular flu season? Nobody would ever go out of their houses again. So these numbers, when you look back in history, they're staggering, just putting a little perspective on here. Okay, with that said, should there be concern? Apparently yes. The microbiologists working on this, the really smart scientists behind the scenes, the public health people, the CDC, the other organizations around the planet that are looking at this, they've really raised the alarm on this, and there's going to be some reasons for that. But looking at the virulence, when I did some study before I came in to do this show, if you look at, for instance, the the death rate so far. Most people are now agreeing that anybody that gets infected, the chance of dying from that is 1% or less. And that's about what the numbers are on a typical influenza year. So it doesn't look like it's particularly fatal when comparing to other influenza strains right now. And I could be wrong, and if somebody wants to educate us with some notes and so forth, that we've got something wrong here. But that's the information that I dug up from scientific sources, CDC and so forth, that again, the death rate looks like it's about the same, less than 1%. If you look at Wuhan province in China, you can see that the numbers skewed up, but most people in the past few days had said, well, there was a concentration of it there. When you spread it to the entire China's numbers, again, you get below that 1% figure of fatality from illness. Then you also look at the people that are dying from this COVID-19 coronavirus. And once again, it's immunocompromised people, it's the elderly. Many people have come out in the reports and said younger, healthier people seem to be actually doing really well. We also might find that those numbers, the death rate, if you will, from this particular virus might actually drop even more, because there might be many people that have actually been exposed and infected, but they only got a sniffle or what was seemingly a cold, or potentially not even sick at all, no symptoms at all, but they were carriers. They were exposed, but they either got mild symptoms or no symptoms at all, and they spread it. So those numbers would drive down that virulence, drive down the severity of illnesses and so forth as we accumulate those numbers. So things interesting just to keep in mind. Here's something else too as we get into some solutions. You and I could be caretakers of people. Back 102 years ago, we're in a ward full of people that are literally dying of the flu. We're taking care of them. We are completely exposed 100 times over, and we never get a sniffle. We never get ill. We never get sick. We never expose any symptoms at all. We could be a caretaker in a room, in a ward full of people that are dying from the flu. We get fully exposed, and we only get mild symptoms. We only get a cold symptoms or whatever, and we never have full-blown symptoms, and we never die from it. So what is the difference? The difference has to be the health of the host. And that's the main thing that I want to transmit to you right now. It's the health of the host. It's not necessarily the virus. It's the health of the host. If you look at COVID-19 and coronavirus right now, as I just said a moment ago, or even just the regular flu virus strains that might be circulating around in flu seasons, who are the people that then tend to succumb to it at those times? And it's people that are already immunocompromised. Again, it's the health of the host. I can think of family members and friends and patients that got really sick just this year from the flu, and many of them needed, some of them needed medical care, but many of them didn't. They just stayed at home and they rode the course of it, and then they were fine. So here's our strategies. This is what I recommend that you can do for yourself right now, for you and your family, to keep yourself protected. And before I give you my list, of course, doing the general things like, if you're sick, stay at home, self-quarantine yourself. That makes sense. It doesn't matter if that's that coronavirus or COVID-19, or if it's just flu, or just a bad cold. Just stay home. If you wash your hands more, and my opinion, and other microbiologist-leaning people tend to feel this way, is you don't have to necessarily use hand sanitizers. Soap and water works really well, really well. So, and lastly, if you don't have access to a sink and water and soap, and I do, by the way, I'm very negative, this is my opinion now, very negative on antibacterial soaps, and I'm very negative on antibacterial hand sanitizers. You just need regular soap, nothing special, and you also just need an alcohol-based hand sanitizer, not one of the antibacterial ones. I think we've really swung in the wrong direction with antibacterial everything. Again, just my opinion, but really smart people came up with this information. Okay, so washing your hands, coughing in the elbow, these things make sense. Stay home if you're sick, makes sense. But what can you really do? What's important here is improving the health of the host, strengthening the immune system of you, your family, your friends, and anybody else who's going to listen. Number one, how about a really healthy diet? We know that lots of processed foods and sugars decreases your immune system effects. Healthy diet, clean up your diet as best you can. That makes total sense. Number 2, regular exercise. We know that when you get regular exercise, it activates components of your immune system response. That's wonderful. All of these strategies, by the way, decrease chronic stress. When you decrease chronic stress, you're going to decrease an overactive sympathetic nervous system and allow the parasympathetic nervous system to kick on a little bit more for a little more relaxation. Got that? Okay. Number 3, spine and chiropractic. Oh, well, why am I talking about taking care of your spine and chiropractic? Well, I've got some great articles here. This is coming from the Texas Chiropractic Association, the official history of chiropractic in Texas, 1978. Why am I mentioning that? There are quotes in here talking about chiropractic to help people back in the 1918 flu pandemic, 102 years ago. What does that have to do with anything? Pay attention. Pay attention. Chiropractic started in 1895, 125 years ago, 1895. For the first couple of decades of chiropractic, we were working on people's spines and nervous systems, but we were only working on the spine and nervous system not because people had back pain and neck pain. That's why people did not go to chiropractors early on. The main thing that chiropractors were working on at the time were infectious diseases, visceral disorders, and mental issues. Okay? Now, we were getting great results by working on the spine and the nervous system, but we would work practicing medicine without a license, so we were thrown in jail and ostracized, and that's why chiropractors were quacks. Okay? Chiropractors at the time were saying, I was about to go out of business, between 1895 and 1918, when the flu epidemic came. When it was over, I was firmly established in practice, said one chiropractor. Why? The answer is simple. Chiropractors got fantastic results from influenza patients, while those under medical care died like flies all around. There are actual numbers, research and published and in print that says the follows. In Davenport, Iowa, which is where chiropractic started, which is where I went to college, 50 medical doctors treated 4,900 cases with 274 deaths. Influenza, 1918. 150 chiropractors treated 1,600 cases with only 1 death. In Iowa, medical treatment for 93,000 patients with 6,000 deaths, which is 1 out of every 15. 1 out of every 15. 4,700 patients were treated by chiropractors with only a loss of 6 cases, or 1 out of every 789 people died under chiropractic care in 1918 for very deadly flu. The numbers get better and better when you expand it nationally. National figures show that 1,100 chiropractors treated 46,000 people with influenza during 1918 with a loss of 54 patients, 1 out of every 886. Again, the numbers just got better and better. New York City. Under medical methods, 10,000 cases of people with influenza, there were 950 deaths. Drugless methods, including chiropractic, 10,000 cases, 25 deaths. So big differences, not a percent, we're talking hundreds of percents of differences. Chiropractors in Oklahoma treated 3,400 cases of influenza with only 7 deaths. There was a clear record showing that chiropractors were called in on 233 cases where medical physicians said, we're giving you up for loss, we have to move on. The chiropractors saved all of those 233, but 25 of them. Most chiropractors and their patients were miraculously spared, and we repeatedly hear about decisions many made to become a chiropractor after a remarkable recovery, or when a close family member given up for dead suddenly came back to vibrant health under chiropractic 102 years ago, 1918 flu pandemic, the thing that put chiropractic on the map to stay. I think it'd be a good idea to maybe consider wellness chiropractic care, even if you don't have neck and back pain, to help your immune system. How does that work? Chiropractors stimulate those fancy nerve endings in the spine called mechanoreceptors, driving information into the spinal cord, immediately affecting the sympathetic chain. Go look that up. And of course, the brain organ immune system communication systems. Better stuff in, better stuff out is the simple answer. So spine and nervous system. Number 4 is water. Drink more water. Don't drink any calories. Stay away from sugared beverages. Stay away from fake sugared beverages. Try to drink only water. A cup of coffee in the morning. Tea is fine. Tea is fine. So more water. Number 5, reducing stress. I call it pressure and challenge. when I get sick, when I succumb to things, and I'm exposed to something, I'm exposed to sick people every day, just like most people in healthcare, they're exposed to sick people every day. But you're not necessarily sick every day because, again, the health of the host determines that. It's like putting up a stronger force field, okay? I notice that I succumb to viruses that are around me and I'm exposed to every day. When I haven't slept well for a couple of days, or I have a little more challenge and pressure with some loss of sleep, reducing stress, really good idea. We've talked about that incessantly on this program. Number 6 would be sleep. Just make sure you get enough sleep, good quality sleep. Try to go to bed at the same time. Try to get up at the same time, even on weekends. Good quality sleep. And number 7, supplements. There are very well demonstrated supplements that help boost the immune system. I'm a fan of vitamin C. Upping vitamin C when you're sick has great literature and science behind it. I think checking your vitamin D level and upping your vitamin D makes sense. A lot of practitioners and scientists agree on that as well. Some B complex vitamins make sense. For some people, a little bit of zinc seems to work well. There are lots of herbal concoctions that people have said seem to help them as well. I like omega-3 essential fatty acids. Omega-3 fats from fish makes sense because those omega-3s are needed in every cell of your body, so making sure that your omega-3 levels are up makes sense to me. The take-home message from this, I believe, is, oh, and by the way, if you're going to travel, we talked about that before the show started. If you're going to travel, just be smart about it. If you have to be somewhere, then you have to be somewhere. And if something is reasonable to reschedule without affecting people on an adverse basis, then it makes sense. Maybe you reschedule that. But again, this is my personal opinion. This is not medical advice. It makes sense to make your decisions so far, unless we hear something else from the scientists and the really smart people that are working on this. It makes sense to me is to treat what's going on like an influenza virus, like a flu virus. Do your certain protocols, like we talked about here. Do your protocols like you would with the flu. It's about the health of the host. I'm Dr. Scott Fuller.